Outbreaks of a deadly drug-resistant fungus in hospitals around the world have prompted a global health agency to declare the fungus a serious threat to human health for the first time ever, and scientists are racing to find new ways to fight it. Here's what we know about this dangerous microbe. Since it was first identified in 2009, Candida auris has been responsible for thousands of infections and hundreds of deaths worldwide. The fungus is a type of yeast that lives on surfaces and can cause illness. If it gets into a person's body, infections with this fungus can lead to sepsis and organ failure and have a mortality rate of up to 60%. That's thought to be how a recent outbreak in India affected more than 700 people, mostly cancer patients. For the general public, the risk of infection is low, although it can be higher in people who work in healthcare or who have recently been in a hospital. Antifungal resistance is a growing problem, and C. auris is especially frustrating because it doesn't respond to most of the drugs we have. This global effort, funded by the UK's National Institute for Health and Care Research, brings together researchers from several institutions in the UK, India, and South Africa. As well as the WHO, they're focusing on two main species, C. auris and Cryptococcus neoformans, which together account for 60% of all Candida infections worldwide. So to all of our patrons, thank you for what you do to make this happen. If you're not a patron, but you want to learn more about what that means, you can go to our support page. These two species are also a particular problem in low and middle-income countries. There's also a lack of effective treatments for invasive candidiasis, which is a serious infection that can affect multiple organs. And on top of that, the standard methods of identifying the different species of Candida don't always work because C. auris looks so much like other harmless Candida. And a separate outbreak in South Africa's Eastern Cape province has been linked to at least 400 deaths since 2019. And disturbingly, it's becoming increasingly common in places where we don't typically see it, such as Africa and South America. But unlike other types of Candida, C. auris is resistant to most antifungal drugs, making it very hard to treat. But they are hoping to make significant progress towards developing new antifungals to treat these deadly infections. So it's important to stay informed, keep an eye on the news, and follow the advice of public health officials. If you do develop symptoms of a Candida infection, get yourself checked out. Don't try to treat it yourself, because that could make things worse. And if you're a healthcare worker, make sure to follow infection control guidelines to prevent the spread of C. auris and other harmful microbes. This research is a great example of how global health organizations are working together to tackle a serious international problem. And hopefully it will make a real difference for patients who need it most. It also has a few tricks up its sleeve to help it survive, like forming biofilms that protect it from our immune systems and antifungal drugs. That makes it especially dangerous for people with weakened immune systems, such as cancer patients or people with HIV. It's not an exaggeration to call this fungus deadly. But there are subtle, microscopic differences that can only be picked up by advanced DNA sequencing techniques. Because it's so hard to identify, the true extent of the problem is unknown. Infections caused by C. auris are often difficult to diagnose because it can look like other types of Candida on a routine lab test. According to the World Health Organization, C. auris has been found in more than 90 countries and is now responsible for at least 1 in 3 bloodstream infections in some hospitals. While the fungus has been found in soil and on food, the main way it spreads is through contact with surfaces and equipment in healthcare settings. As worrisome as all of this is, the good news is that it seems to be mostly limited to hospitals and other healthcare facilities. The trouble with Candida auris is that it's just getting harder and harder to treat, but now there's hope on the horizon. Scientists have launched a new project to develop a new class of drugs to combat this dangerous fungus. There's a lot of work ahead of them, and this project will run until 2028. At the moment, scientists don't think C. auris poses a risk to people who aren't in hospital, but that could change. Thanks for watching this episode. We've made thousands of educational videos over the years, and we've been able to offer them for free because of our patrons.